I have an amendment at the desk. It's Castor 031.
The clerk will report.
Amendment to H.R. 249.
Without objection, the reading of the amendment is dispensed with, and the gentlelady from Florida is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman, and good morning, colleagues. My amendment would insert permanent extension of the current ACA, Affordable Care Act, tax credits. Colleagues, all across the country right now, families and small business owners are really grappling with, they're bracing for higher health insurance premiums due to the provisions of the big ugly bill. This comes at a rotten time because they're already having to pencil out how am I going to pay my utility bill, groceries, housing, and it does not have to be this way when it comes to their health insurance. There is still time for the Congress to help the families and small business owners we represent back home fix the broken health care system and keep health insurance affordable for so many of our neighbors who do not have health insurance through their employer. Colleagues, this would be the fiscally responsible and ethically right thing to do to fix one of the major flaws in the big ugly bill, to reinstate the tax credits that make coverage affordable. These tax credits are cost-saving and they are life-saving. And when it comes to rural communities, the National Rural Health Association projects that rural enrollees will see premiums nearly double, with an average increase of $133 a month, and rural areas are projected to see a 30% drop in marketplace coverage and a 37% rise in the number of people without insurance. And when so many people do not have insurance, that affects everyone, because where did they go for their health care then? Oftentimes they'll wind up in the emergency room. And that means that ERs back up, so you'll have longer waiting times. But then all of those costs migrate to health insurance premiums for everyone else. That's not fair, and that's not right. And that's why over the past few weeks, since the big ugly bill was passed, hospitals have been very outspoken. Doctors, nurses, advocates have been here saying, wait a minute, what you've done here is really going to cause a lot of pain across the board. I hope everyone's listening to them. We really should take the advantage of this opportunity to fix this major inequity in the big ugly bill that gave tax breaks to the wealthy and the well-connected, but then took away these enhanced premium tax credits that help make people give them the ability to have health insurance. And there are a lot of Floridians on this committee, and this really hits home in the Sunshine State because we didn't expand Medicaid. We have over 4.7 million Florida families who rely on these tax credits. And I'm beseeching you, the time to act is now to get them reinstated. Nearly 4.1 million of those we have 4.7 million in the ACA. 4.1 use the tax credits to pay for their premiums and keep their coverage for their families. Think about the cancer patient now that they're going to have an interruption in service. Where do they go? For that family, that they're doing everything right. They're probably working part-time and taking care of the kids, but they don't have an employer that offers health insurance. And now you're taking away the pathway for them to do the responsible thing and keep their family covered. It's not right. These tax credits have helped Americans afford high-quality coverage since 2021, and it's part of the important fix in making sure that this insurance coverage is still available to them. Every member in this room, I know, has heard from neighbors and doctors and hospitals who are saying, act now. And I heard the speaker yesterday say, maybe we'll wait till December. We can't wait till December because the insurance companies now are already planning their open enrollment. Open enrollment starts over the next couple of months. We have to act before the end of September, before it is too late. Americans simply cannot afford this is essentially a tax increase that you've given them. And they can't afford that right now with everything else that's coming down upon them. the pain and the harm and the risk to families is simply too high for us not to act. So I'm beseeching you to approve this amendment, and let's all get to work on helping our neighbors instead of the powerful special interests that often have too much power here in Washington, D.C. I yield back my time.